From the creators of the Diabetes Conversations program comes the latest addition to their innovative education resources, the Conversation Starter Education Tools for One-on-One Interactions. Created by Healthy Interactions in collaboration with the Eli Lilly, the Conversation Starter tools were adapted from the content of the group Conversation Map Tools for Diabetes Self-Management Education, but meant for one-on-one interactions for people with diabetes. Like the group tool, the Conversation Starter Education Tool is designed to improve patient engagement, advance diabetes self-management education, and optimize diabetes care outcomes. When group sessions are not possible, the Conversation Starter Tool is a fun and comprehensive way to deliver one-on-one diabetes self-management education. The Conversation Starter has a small easel design, which makes the tools perfect to use on surfaces such as desks, counters, and exam tables. When the tool is set up, the patient can see a full map visual lying flat on the table, as well as other visual elements on the upright portion of the easel. At the same time, the facilitator is able to see the recommended questions, relevant tips and answers, and a smaller version of what the patient sees. Just like the facilitator guide of the group tools, the Conversation Starter offers a structured flow for the facilitator to follow and make the most of their conversation with the patient. It is made up of Socratic-based questions intended to help patients come to their own conclusions about how to best manage their diabetes. The tools are divided into modules, so the facilitator can use the entire tool or just the modules that they feel are most relevant for their patient, given the time available for a session. To have a successful and productive one-on-one interaction, follow these simple guidelines. Use the facilitator guide. The facilitator guide is the key to a session. It's okay to read from the guide in your first few sessions. Once you're more familiar with the tools, facilitating a session will start to feel much more natural. Follow the questions. Ask the questions as they are written in the facilitator guide.
So John, in your own words, how would you describe diabetes?
The questions are aligned with the learning objectives and are designed to promote active participation. Utilizing these questions will also ensure that you've covered all the content as it has been designed and tested. Discuss and share experiences. Allow your patient to think through and respond to the questions.
Diabetes is not enough insulin to counteract the sugar in your blood.
Simply providing the answers does not promote critical thinking or result in a rich and meaningful learning experience. Focus on the goal. The goal-setting exercise is an important first step to sustainable behavior change. The best way to get started is to dive right in. Here are some tips to making the experience positive for both you and the patient. Set up the tool in the space you plan to use for the session. When the tool is set up, make sure that it doesn't create a barrier between you and your patient. Be familiar with the individual modules and how they relate to the map as a whole. Prepare and print any supporting documentation you want to use with the Conversation Starter Education Tool. Take a deep breath, smile, and have a meaningful patient education experience.
So you're going to do three things. You're going to eat breakfast. You're not going to skip breakfast. Right. The second thing is you're going to increase your physical activity by going to your health club more often. And the third one is you're going to go to your support group.
Like all tools from Healthy Interactions, the goal is to provide engaging patient interactions that help people think about topics in new ways. So remember, when facilitating a session, encourage conversation instead of simply providing all the answers.
Why do you think we have three different types of insulins?
Well, it looks like that the basal is more of an even 24-hour. It gives the same amount or similar amount of insulin all day long.
Avoid lecturing.
John, what will you do differently till the next time I will see you?
Well, I have to be a little more conscientious about eating breakfast every day, which I try to do now, but sometimes when I'm in a hurry, I don't eat breakfast, but then I should eat protein every morning.
Encourage the patient to come to his or her own conclusions.
With the goals, we would like to always commit to a specific time. So if you say, I'm going to exercise more,
Tuesday.
perfect, that's the answer.
Focus on a clinically meaningful conversation.
So in summary, what you're going to do differently is you're going to have breakfast every day.
That's something I have to work on.
Exactly, making sure that you have protein in it and a
Yes.
fruit. And then also you will make sure that you do if you're going to go to workout 5 times a week.
Make sure the patient does most of the talking during the session.
I go to this wonderful support network once a month, and I will continue to do that because that's been very helpful.
Thank you for taking a few minutes to learn about the Conversation Starter education tools. You will find them to be a great point of reference for your one-on-one interactions for people with diabetes.